At this point, we're going to move on to the phase 2 shoulder exercises. Generally, this is a period of time where you're past that initial early post-operative period. In general, we're looking at a time frame 2 to 6 weeks after surgery. Again, that can be a little variable depending on the exact procedure you had done and your surgeon's preferences. These exercises are ones that should be not forceful. We're looking at doing gentle stretching, slow, deliberate, to tolerable discomfort, avoiding pain. The therapist will go through these with you in detail, but in general, we're doing exercises that are more passive or active assisted, where your good arm is aiding your bad arm in doing these exercises. And with that, I'm going to move on to the physical therapist.
So the first exercise we're going to start with is cane flexion. You're going to use a cane in your opposite non-surgical arm to help your surgical arm stretch overhead.
Make sure that the surgical arm is not doing the work. The non-surgical arm is doing most of the work, pulling you up into a gentle stretch to increase the range of motion as is comfortable.
So the next exercise we'll do is cane scaption. What you're going to do is you're going to hold the end of the cane with your surgical hand. Again, you're going to use your non-surgical hand in the cane to bring your arm up and overhead. This time, we're going to go at an angle. Instead of straight overhead, you'll see almost a 45-degree angle away from your body.
Again, you're using your non-surgical arm to move the surgical arm up at a diagonal toward your ear. Again, a gentle stretch. You're not moving quickly, slowly, and you don't want to have any pain.
So the next exercise we're going to move on to is the cane internal-external rotation. So again, you're going to hold the cane with your surgical hand, and you're going to use your non-surgical hand to help push it out to the side. So you're going to push out.
Moving into a position away toward the body, away from the body, and then slowly moving in. Again, the non-surgical arm is doing the work. Okay, and moving into external rotation is moving away from the body, and the non-surgical arm is doing most of the work, pushing the surgical arm out into the external rotation away from the body, shown in the picture.
Our next exercise that we'll do is the table or counter flexion stretch. So you're going to start with both hands on the table, and you're going to slowly walk back until you feel a gentle stretch. You may not be able to get as far back as she's getting. Just go within your tolerance of that shoulder.
And again, make sure that you are slowly moving back with the legs. Legs are doing most of the movement, and just stretching the surgical arm in a comfortable, easy stretch.
The next exercise is the counter or table slide. You want to find a surface that you can comfortably sit next to and place your arm down and rest it on the surface. If you want to use a folded up towel to help you slide, you can do that as well. You're going to very gently use that surgical arm to slide across the table. Again, you may not be able to make it through full range of motion, but you want to slide until you feel a good stretch.
So with this exercise, you're also making sure that you're sliding through and using your body to help you get into the motion of shoulder flexion or lifting that arm, moving it to the side next to you.